Hey everyone, thank you for sticking with us so far. Welcome to part 3 of the coronavirus and surgery vlog, where we talk about how the coronavirus is changing your surgical experience. I'm Dan, I'm one of the nurse practitioners and patient partners here at Right Device, as well as an orthopedic nurse practitioner. Before we get started, don't forget to hit that subscribe button so you can get the latest up-to-date videos from us, as well as surgeons from around the country about how they perform their specific orthopedic surgery. Also, check out our website where you can join to find a patient partner who has had the same exact surgery like you, as well as our medical device database where you can get the latest reviews, updates, and studies regarding your medical device. So in part 3, we're going to be talking about some things that you should notice that your hospital or clinic is doing to keep you safe. This can be applied also to any of the businesses or restaurants that you may see around your area. So the first two things we actually talked about in the previous vlog in part 2, and that is additional screening processes at the entrances of the hospital or clinics, where they take your temperatures and ask if you have any symptoms lately, as well as limiting visitors, maybe just one visitor per visit at the clinic or in the hospital. So one thing hopefully that you see as you walk into your clinic or hospitals is visual aids or posters to ensure that you maintain a proper social distance of 6 feet between other patients and the staff as well. One of the most simplest and effective ways of not getting the coronavirus is simply by washing your hands and wearing a mask. So hopefully when you walk into the hospital or the clinic, you see a lot of hand sanitizers around, as well as everyone wearing a mask. There should be masks available for those who don't have one, and hopefully you're already wearing one prior to even being at the hospital or clinic. There should also be some wipes available as well for, when you touch the door handles or the magazines, you can wipe down the seats prior to sitting there. That's just one additional thing that can help maintain safety between patients. One of the most foolproof ways of not contracting the coronavirus or spreading it is limiting in-person to person contact. You should see if your surgeon or your hospital system offers some sort of telemedicine access. That way you can do maybe your pre-op consult or one of your post-op checks without even having to step foot into the office. And they can determine whether you need to go in or you can do your normal follow-up a little bit later. Thank you guys for joining me for part 3 of our surgery and coronavirus series. Hopefully it's been super informative. If you have any questions, you can leave them in the comments. And don't forget to hit our subscribe button, as well as follow us on our social media accounts at Facebook, Twitter, and Instagram.